Okay, let's unpack this. We're diving deep today into, well, a really big topic,
Yeah.
mental health. Issues like insomnia, anxiety, depression,
Mm-hmm.
they're a growing challenge globally.
Mm-hmm.
And artificial intelligence seems to be stepping up,
Yeah.
right? Becoming a really powerful tool in this space.
Absolutely. And what's fascinating is we've got this huge new analysis to draw on. It covers 24 years of research looking at, get this, 875 different articles.
Wow, 875. That's comprehensive.
It really is. So our mission for you today is to kind of distill that down, find the key insights, the research hotspots, and, where this is all heading. Because AI isn't just a helper anymore.
It's becoming
It's
critical.
looking like a potential game changer, yeah. Offering precision in diagnosis, personalization in treatment, things we haven't really seen before on this scale.
Okay, so where's this analysis start? I saw something about rapid growth.
Definitely. That's one of the first big takeaways. The number of publications in this field has just exploded, especially like in the last 5 years.
A real boom then.
A total boom. You've got researchers from, I think, 74 countries contributing. It really signals this global urgency, and the sheer potential people see here.
And are there leaders in this research push?
Yeah, if you look at the big picture, the United States and China are really leading the way, both in terms of how much research they're putting out and the collaborations they're involved in.
Okay.
The U.S. tends to get the highest citation, so its work is pretty influential in shaping the field. But the University of Toronto, interestingly, is the single most productive institution globally.
Huh. Interesting geographical spread.
It is. And this leadership, it doesn't just push the science forward. It also kind of sets the standards for how AI actually gets integrated into mental health care worldwide.
Right, which brings us to the practical side. It's great seeing this global effort, but how does it actually translate into helping people, like for personalized support or diagnosis? How is AI showing up right now?
Good question. The research really highlights three main ways. First up is machine learning. It's proving really good at predicting treatment outcomes. For depression, for instance, there was a key study back in 2016.
I think I saw that one mentioned, Checkraut et al.
That's the one. They used machine learning models, fed them patient data, and were able to optimize personalized treatment strategies. It helps cut down on that frustrating trial and error process.
Trying to predict who might respond best to which therapy.
Exactly. Imagine getting a more direct path to feeling better, rather than just trying different things hoping one sticks.
That sounds incredibly valuable, especially for something as complex as depression, moving beyond that one-size-fits-all idea.
Precisely. Then the second big area is deep learning, particularly neural networks.
Okay, deep learning. How's that different?
Think of it as more sophisticated pattern recognition. It's really transforming automated diagnosis. Another study, Akaria et al., from 2018, used these deep networks to analyze EEG data brainwaves, basically. And they achieved highly accurate depression screening just from that data. So it raises this really important possibility. What if early, objective detection becomes routine, powered by these kinds of systems?
Wow. Spotting neurological signs maybe years earlier, that could completely change preventative care, couldn't it?
It really could.
And the third area, you mentioned making therapy itself more accessible.
Yes, exactly. Human-computer interaction and AI-assisted therapy. This is where you see things like AI-powered smart devices, virtual reality being used for therapy.
And chatbots, right?
And chatbots, yes.
Right.
They're making treatment much more accessible. There was a study, Fitzpatrick et al., 2017, that looked at an AI chatbot called Wobot.
Wobot, okay.
And it actually showed that using Wobot significantly reduced depression and anxiety symptoms in university students. And get this, within just 2 weeks.
2 weeks. That's
Yeah.
remarkably fast.
It is. Pretty striking results.
But I have to ask, I mean, this all sounds incredibly exciting, revolutionary even. But are there downsides, hurdles? What are the challenges people are running into when trying to bring AI into mental health? It seems like a sensitive area.
Oh, absolutely. There are definitely significant hurdles. One major one is the black box problem.
Meaning we don't always know how the AI reaches its conclusion.
Exactly. The decisions aren't easily interpretable. We see the output, the prediction or diagnosis, but understanding the why behind it can be difficult. And that makes building trust hard, for both clinicians and patients.
That makes sense. What else?
Well, there are huge data privacy concerns, obviously. We're dealing with extremely sensitive information. And then there's the challenge of algorithmic bias.
Bias. How so?
If the data used to train the AI reflects existing societal biases, the AI might learn and even amplify them. That could lead to, say, unequal access to care or inaccurate diagnoses for certain groups. Big ethical questions there.
So it's really about building these tools carefully, ensuring transparency and fairness.
Yes, that has to be the focus moving forward. Future work really needs to nail down improving data quality, making the models more interpretable, explaining that why, and integrating AI into clinical practice thoughtfully.
So it's about empowering clinicians, not replacing them.
That's the goal, augmenting their abilities, providing better tools.
Okay. So AI's role here is definitely expanding fast.
Mm.
It holds this incredible promise for more intelligent diagnosis, more personalized treatment, potentially transforming lives.
Precisely. And the path forward seems to involve continued innovation, especially in areas like multimodal data fusion.
Multimodal, meaning?
Meaning combining different types of data, like analyzing facial expressions, voice patterns, maybe even physiological signals like heart rate altogether, to get a much richer, more holistic picture of someone's mental state.
I see. Combining different signals.
Exactly. But crucially, all this innovation has to go hand in hand with really strong ethical safeguards and a solid commitment to data privacy. That's non-negotiable.
Absolutely. So as you're listening and processing this deep dive, maybe think about this. How might AI really fundamentally change how we approach mental well-being for ourselves, for our communities, in the years ahead? Could it offer solutions we barely imagined before?